Hello, Horizon Summit. I am Dan Kaufman, Sport Techie's Managing Director. This is Safely Bringing Fans Back to the Venue, powered by SKIDATA. I am pleased to welcome to the stage Vicky Seifert-Margolis, CEO and founder of My Own Med, and Andy Pfeffer, Head of Events and Venues at SKIDATA. Welcome to the stage.
Thanks, Dan.
Thank you.
All right, so let's get started. This is, as I said, safely bringing fans back to the venue. And throughout the world, and especially in the US, fans are back in venues, in many cases in full capacity and maskless, especially here in the US. But at the same time, we're seeing plenty of news about the Delta variant, and we're also seeing news about vaccinated individuals actually contracting the virus, including some prominent professional athletes recently. Let's do a level set. And Vicky, I think I'll start with you if I can, and then we'll pitch it to Andy. But I'm going to ask this question. How concerned should venue operators, sports venue operators, be about the Delta variant and what we've seen recently?
Well, I think like everything in this pandemic, we're going through multiple twists and turns, and the Delta variant is certainly concerning. In that it seems to be far more contagious. It seems to be something now that we're acknowledging as scientists can be transmitted even by people who are vaccinated. And it is definitely starting to really take off in the unvaccinated population in the United States. And clearly we saw what the impact of Delta was in other countries like India. I think the other concern right now is what might follow. As biologists, I'm an immunologist by training. We know that there's a lot of what's called evolutionary pressure on the virus right now, meaning there's not a sufficient number of people vaccinated. There's still a lot of reservoirs that are available for the virus to replicate, and we know that the virus is pretty darn good at mutating. So I think that's why you're seeing a little bit of an amping up of the message to get people out and get vaccinated, which of course I completely agree with, but also to try to think about how we might put in place other risk mitigation strategies. And I think the unfortunate part is this is happening in a background of pandemic fatigue, particularly with respect to things like wearing masks. And one of the struggles, particularly for people like you all in the sports industry or entertainment industry, is such a large part of the experience is sitting in proximity to people, eating, drinking, having fun, not something that people really want to be doing with a mask on.
Yeah, it's really interesting. I mean, sports in and of itself is almost like the perfect place to do everything that is recommended not to do if you don't have the virus, right? Screaming, sitting close and hugging and all that. But Andy, I'm going to pitch it to you, and let's dive into the technologies that are available, separate from the vaccinations themselves, but the technologies that are available to help venue operators bring fans back and continue to bring fans back safely. In our prep call, we talked a little bit about, I think the phrase was embedded medical credentials or embedded technologies versus non-embedded. Tell us a little about that, and then also tell us a little bit about Safe Guest, which was specific to something you did in Europe.
Yeah, so I mean, I think it's really interesting what's happening in the space now in terms of how we're thinking about getting fans back into venues, considering the COVID virus, even after the fact now in the US where we've let masses of fans back in the stadiums. It's still a concern for a lot of venue operators, for teams, as well as for the fans. What we've done is we've thought about it in a different way. At SKIDATA, we've got an enterprise platform where we assign a singular unique ID, a fan ID per se, to each individual. That allows us then to take that fan ID associated to the ticket and a medical credential. We believe that as we looked at the space, that it had been technology trying to solve a medical crisis. And when we partnered with Vicky and My Own Med, we said, nope, there should be a medical expertise and solution to approach to solve a health crisis using technology. And that's a much different nuance. In Europe, what we were able to do both with Formula E and FIS skiing was the first company globally to embed a medical credential, a go or no go, into a venue. And now we've taken that here in the US, where we've created through that singular ID, a single scan at entry rather than multiple scans outside the venue. So Dan, when you have 75,000 people outside the San Francisco 49ers, for example, getting those people in time into the venue already through security, already through the gates is a time-consuming endeavor. If you have to add a third layer on top of that with a separate scan, it's just untenable, and people in the stadium ops industry understand that. So what we've been able to do uniquely with MyOwnMed and with the medical credential, without divulging any medical information, is to embed it directly in the point of access, at the point of access, through contactless entry, which has taken on a life of its own now after COVID.
And so tell me what specifically is actually in that. What's embedded within there? What's the information that the venue operator is able to say, okay, good to go? Is it, vaccine status? Is it a test that the person recently had? What is it?
Yeah, so I mean, Vicky would probably tell you that we want to be agnostic in terms of what the teams have to do, right? We want to depoliticize this, meaning that whether it be a vaccine, an antibody test, a PCR test, symptom tracker, whatever it might be, the option lays with the team on how they want to do that. We found out very clearly in PR with a lot of companies that mandating the vaccine in and of itself leads to pushback. And so the teams should be able to provide, and we provide that option within the platform and let the teams determine what that might be.
Right. And then in order to preserve privacy, all that we're passing on to embed is essentially a yes, clear, no, not, and a duration for that clearance. So for example, for season ticket holders who would produce evidence of vaccine, that clearance could be sustained for the whole season. And we on our side, since we're a medical company that's been working in decentralized clinical trials, clinical research, and clinical care management using mobile platforms and digital for years, are steeped in compliance and regulatory systems and processes in place that protect the privacy of patients. We also manage all of the disclosures and consent information that may be required in different state jurisdictions or different country jurisdictions. For example, GDPR, which exists in the EU as well as in California. And we're ex-FDA officials, public health officials, so we're very well versed in this, and we know how to do it and protect that privacy, manage that personal health information, and then just pass along what needs to be passed along to provide for the clearance through the embed in the NFC credential.
Andy, I want to dive a little deeper, even if we can, on how is this different from other solutions, right, that are out there, and maybe walk us through how it worked with Formula E in Europe. Literally, the process. Take us through the game day experience, and explain a little more why some of the other solutions might be kind of untenable for actual effective game day solutions.
Yeah, I mean, I think at SKIDATA, the idea was to use this enterprise platform in the background to be able to embed the medical credential. We named it SafeGuest. And as you noted, it was launched in Europe with Formula E and FIS skiing. The easy part was to get the venue or the stadium operator to buy into safely bringing fans back in. The hard part was thinking about logistically, how do we do that in a very smart, sophisticated, and seamless way for the fan? And I think everyone's been thinking about that, but we haven't really come up with it until we figured out how to embed the medical credential directly into access control. And it's simple. For teams that have team apps, this app would lie directly and be white labeled directly into the team app. Now, anyone listening on a team knows that the goal is to get more people engaged with your team app and to download it, because there's a one-to-one relationship, in this case, built around health. Everyone then engages with the team app directly. They upload the medical credential required by the club, whether it be a vaccine, a PCR test, an antibody test, a symptom tracker, or just an update on what they do. And that automatically, as Vicky pointed out, is kept in a separate database, confidential, compliant with HIPAA. The team never sees it. The ticketing system never sees it. And SKIDATA never sees that information. It's green or no green. Now, what you've seen in the space now, typically in the US, is they're looking to do two things, right? They're not quite sure how to do it. And so manually, some of these teams will start taking looks and reads from security guards or ticket takers, which is not optimal, because those people can't be considered, whether it's expired or it's not a proper credential. To think that that's going to be a legitimate way is certainly not the best way. And then a separate scan potentially outside the stadium, again, from a logistics standpoint of time and effort taken by the fan, doesn't seem tenable. And what we're seeing now, I think, is in Europe, because of what's happening with the Delta variant and COVID and some of the government restrictions on venues, particularly in England, in Germany and Italy, they're coming to us saying, how do we do this? How do we figure this out so that it becomes seamless to the fan and end user? And I think because we've been able to figure out this kind of single scan solution and easy integration within a team app, more teams now are thinking about this in a different way.
I think if I could add one more thing, Dan, I think the idea of adaptable is really important and central to our platform. Again, since we've been dealing with clinical management and clinical trials for quite a while now, we've had to build a fully configurable platform. So what that means is we can adapt as we go through different phases of the pandemic. So consider this, about a year and a half ago, we were solely focused on symptom tracking. Then we realized that the pandemic was primarily about asymptomatic people, and we moved into a heavy testing phase. Now, more recently, we're moving to vaccines. So we've built in the capability to upload vaccine cards and use optical character recognition to read those cards. And we can verify them or not verify them, just take the data in terms of just seeing what's on the card. I don't want to talk about falsified cards, or we may be moving back in the fall to symptom tracking. I'm working with healthcare systems, for example, that are very focused on symptom tracking again in combination with vaccine status because of potential of reinfection or flu. So our platform has been built completely configurable so you can plug and play and change over time as the pandemic has evolved. And that was really in large part built by necessity because we've been at this since March 2020 and gone through, multiple iterations of this pandemic.
Yeah, you said something interesting there, Vicki, that I just want to follow up on. Why is it that you think in the fall we'll go back to symptom tracking as being more important?
Well, I think because, what we're seeing already is a significant increase in respiratory viruses, and it's starting in kids and young adults. We're seeing a very, very early wave of respiratory syncytial virus, which is very uncommon among children right now. Partly part of it is a result of the fact that we were kind of in these environments where we were locked away and now we're out and about again without masks. And so, the common viruses that are respiratory viruses are resurfacing. And so the symptoms become important. And as we look at whether or not, we're thinking COVID may be coming back again, even in people who are vaccinated, symptoms are kind of that canary in a coal mine, because I don't think we're going to go back to this, regular massive testing protocols like we were managing on the university campuses. We were managing, 15, 20,000 tests a week among a student population just to keep them in the dorms and keep them in classrooms and to keep their athletes playing who are getting daily tests. So I think, we're trying to, again, manage this in the different phases that the pandemic is in.
Got it. So I do want to talk a little bit about vaccine mandates. And, there's been some stuff in the news recently. Is there an appetite among sports venue operators for vaccine mandates for fans? Should there be? And, specifically within that question, let's talk about how an operator can effectively message fans and get the message across properly so that it's properly received. And then also how can, they benefit from that on the back end if, through fan engagement or other methods. Feel free, Andy, if you'd like to start with that one, or Vicki, whatever you think.
Yeah, no, I think, I'll let Vicki speak to the vaccine mandates within the public health space.
Yeah.
But I think there's an opportunity for teams here in looking at health in particular as an opportunity from a revenue stream. So if you've got the ability to engage fans in a new way who are greatly interested in this topic through your team app, it serves to provide opportunities for sponsorship and partnership. Vicki will talk about it, but there's, just looking at live TV broadcasts right now, there's a huge percentage of pharmaceuticals and health companies advertising on that. The ability then to take a digital platform like your team app and have a health component attached to it, whether it has anything to do with entry or not, is really unique. And the teams that are the most forward thinking around health of their fans, engaging and leveraging that, will create new revenue opportunities around this rather than what you can't do. I do think in terms of vaccine mandates, what we've seen in the space is there's been a huge pushback from venues, from industries that have demanded that there be a vaccine, and they've backed off. And I think the interesting play is you've got to have the flexibility within a platform to offer a variety of different types of entry based on whether it's a vaccine, an antibody, a PCR. There's a number of people in the world that have autoimmune diseases that Vicki will talk about aren't able to take the vaccine. There's the political, component of this, which we don't want to get into today, whether someone will or won't. The point is that teams have to be flexible enough to give those types of choices, and then think about it in a way of how do we take content, even going forward after COVID. Health has become such a bigger part of contactless entry. Don't touch me coming into the venue. It's faster, it's cheaper. Yeah. Contactless payments, which a lot of teams, including the 49ers, have done as well. And they're teams that are looking for not only from revenue perspective, but from a health perspective, they'll be the ones that win going forward. Vicki, you want to talk a little bit about vaccine?
Yeah, I mean, I think the vaccine mandate question is really challenging, obviously. I don't think there's a huge appetite among anybody in the entertainment industry to do it. I think from my perspective, probably the best thing is optionality. So, allowing people to present vaccine information, and or if they don't want to do that, they don't have to tell you whether they're vaccinated or not, but potentially allow them to, enroll in some sort of testing program. And we have to really recognize that children aren't eligible for the vaccine yet. And we know that sports is a family affair where many children under 12 attend games. So we, again, back to thinking about a technology layer that's flexible and adaptive is really, really critical so that you can provide options to the fans. I think we're going to see tomorrow or in the next day or two a mandate for vaccines for federal government employees. I can tell you I've been working with universities that are doing vaccine mandates. And even in the situation of a mandate, it's quite complex because there are things like medical waivers, there are things like religious exemptions, things that teams and businesses definitely do not want to deal with. So I think, I keep coming back to options to mitigate risk. I really think that's where we are, is where are we in the risk continuum? What's going on in my locale? What's the environment? Are we in a high infection area? Are we in low infection area? And what kinds of processes and procedures do we need to put in place to make people feel safe and to mitigate risk for the organization? And I think there's a very doable path with these kind of multimodal approaches.
How can venue operators or sports teams work with public officials to kind of help to influence some of the policies that they put in place when it comes to these types of things, when it comes to whether it's some sort of a response to COVID or a vaccine mandate or something like that? And in particular, how can the technology we're talking about help those public officials understand what they need to understand? And how can maybe a venue operator say, hey, look, this is the data we've gathered, and here's what we think you need to do. Please help us.
So I think this is a really important under thought through point, is the value of the data that you're getting. So for example, I'm working with a major university system, and we've been capturing data, a couple systems and the city of Philadelphia. And it turns out that we then got a large project from Bill and Melinda Gates to actually look at what's going on in the community of North Philly and West Philly. And these are areas where large venues sit, in some of these communities. And essentially what you have is a significant sample size. Now, we're not talking about selling personal health information. I want to be very clear, but what we're talking about is the ability to have a handle on a percentage vaccinated rate or a percentage, positivity rate or things like that that may not be entirely accurate, but could be very helpful in sort of the gov affairs, gov relations area, where you say, first of all, we're putting programs in place to mitigate risk. And second of all, we're going to be sort of tracking this and keeping track of people, and we can provide some valuable data. And you can also have things like opt-in for people who want to participate, as Andy was saying, in programs where they may want to give over data for, enabling public health research, et cetera.
And I think, Dan, one of the key tenets that most teams have is giving back in the community, one of the key pillars that all teams do. And a lot of the venues sit in, lower area demographics, poor areas, often in cities and downtown cities where these are. And the opportunity then to take this anonymized data and proactively work with local government officials and health officials to give an unbiased look at who's coming to the venue is critical. Plus, I think, already some of these venues have been using their parking lots and their facilities for vaccinations. Some of the athletes at these teams have actively gone out for public service announcements for vaccines. I think there's a host of things that they could do within the space to build upon the momentum, but using the data and proactively going. As Vicky would say, having been a public health official before, if teams are waiting for public health officials or local officials to mandate, it's not going to happen.
Yeah.
It's incumbent upon the team and the venue to proactively put together plans, put together ideas, and go to local health officials and then local government officials and let them respond back. And I think that will be the play going forward as we see what happens in space.
Or they'll mandate in a way that you're not happy with, right?
Yeah.
It's kind of an all or none. So let's, we can talk about LA, and I'm sure there's a lot of people that aren't happy with, indoor mask mandates again. And again, I think if we can take a data-driven approach to help work with, the public health officials, it can be helpful to help build your case for what you're doing and how you can help be part of the solution. I also think, obviously, this industry has a huge influence on communities and on many of the programs that exist with respect to sports teams showing they care about the community. And this is just, potentially another way they can do that.
Yeah, well said. Andy, you touched on it a little bit, but I want to dive deeper into it. Let's talk about how, not only is this helpful, or the technologies are not only helpful to more efficiently kind of get fans into the stadium and keep everyone safe, but it's also, potential to drive additional revenue, and not just tangential revenue, but, new revenue. And one of the things you mentioned was just, sponsorship opportunities. Tell us more. What
well, I think there's a couple things to look at. For the longest time, what you see out in the industry is entry into venues has been thought of in a silo. In other words, they've separated technology from other parts of the experience, i.e. retail, concessions, sponsorship. And that isolation of technology has not allowed the different data to be collected to have a 365-degree view of the fan. So, for example, most venues today, still in the US, use handhelds at the gates. That's an expensive component of labor. It's actually about 80% cheaper on labor to utilize contactless entry, self-ticketing. The pandemic and COVID has kind of spurred that along, and CFOs now are starting to realize that the cost savings alone from contactless entry, which is both from a health perspective safer, but from a financial perspective, creates an incredible savings. And when you think about connecting an enterprise platform, I'm thinking sponsorship now, that notion of a fan ID and attaching it to a single credential to parking, which has not been done in the space from any ticketing system, to entry into the venue, to payments, and to sponsorship, which is what we've done, which has allowed Vicky and the enterprise platform to take a medical credential in. All of that then leads to sponsorship opportunities across multiple touch points within a venue. And I think a lot of teams now are starting to think about, how do we take these various experience and touch points, both inside the venue and outside, and connect them in a very smart way. If you're able to do that, then you could talk about sponsorship in terms of engaging fans both inside of a venue, outside the venue, whether it be at retail, through parking, through the team app, in a different way. And the most forward-thinking organizations now are looking at this in a different way of connecting those disparate technologies and not looking at it as entry or parking separately, but looking at it through an enterprise platform of getting a 365. And there's a couple teams out there in the space. The 49ers are starting to go that way. There's a couple teams both in baseball in Europe. Manchester United, a client of ours, is looking that way. You're starting to see that. And I think it's to your point, sponsors are looking for unique ways to connect, not only through one access point, but through multiple access points to the fan experience.
Interesting. Thank you, Andy. We mentioned privacy a little bit. I want to hit it head on. How do you address the privacy concerns that people might have, whether founded or unfounded?
Options, disclosures, being very forthright in policies about what you're doing and why you're asking, and we have disclosure as part of our workflow and everything we do. So we're fully informing the fan what we're doing, what we're collecting, why, and asking them to accept those accept those terms, but in very clear, not like, the terms and conditions you see on an app, but in really clear, plain language. Again, something that we have to do when we're doing clinical research is you have to really be very clear and plain about what you're doing and why. So I think that's an important part of it. And then I think it goes back to where we sort of started the conversation and something Andy was mentioning, which is people like me. I was an official, in the Obama administration for 8 years, working in the commissioner's office at the FDA. I've had a long history in clinical research, clinical trials. We've been dealing with privacy concerns on personal health information for a long time. But I think it does take people and companies that understand that to do this well, because it changes, and people are very sensitized to health information. And what you really try to do is minimize what you're asking for, and again, be fully transparent and upfront, and also be fully transparent that you are honoring their data and giving them the option to ask you to delete the data. That's what GDPR is all about, which is if they request that the data is deleted from the database, we delete it. And these are all really important components that we deal with on a daily basis, with far more information about medical health, experimental medications. We're doing 2 vaccine trials right now, comparing Moderna and Pfizer vaccines and taking data direct from patients, looking at, vulnerable populations, people with allergies, people with immune compromised conditions. So these are all things that, medical expertise, regulatory and compliance expertise is really important. When we're dealing with organizations, we are often talking to the compliance officers and to the general counsel, and we know how to structure the agreements, how to structure the terms, how to deal with the data.
Thank you, Vicki. All right, so I'm going to leave you guys with this, and I'll phrase it this way. Over the past 6 months, 7 months or so, I've been feeling really positive, just from a personal perspective. I've gone to sporting events without a mask. I've taken my family to sporting events without a mask, and I wanted that to continue. But tell us, where do we go from here, and what's next over the next 6 months?
Yeah, I think things are already starting to return to somewhat normal. You're seeing fans back in stadiums. You're seeing teams now, with vaccines, with the athletes on the field. There's a greater sense of optimism that we're coming back. But as Vicki would point out, hopefully we don't get too complacent. I think, the difference, again, going back between here and Europe, I think here, a lot of the venues and teams are thinking about how do we have credentials for guest services staff, our own employees that we can take care of at a minimum. And I think in Europe, because of the mandates from those governments, they're looking at it a little bit more broadly. And I think we've got to be flexible enough and understand going forward that this is a fluid situation and things can change. And the teams and venues that are prepared for that change, that have the flexibility and the enterprise platform behind them to do this at a moment's notice, those will be the ones that are prepared then to handle any particular change in the future.
Yeah, I think to add to that also, to recognize that pandemics are, culture changes, just like, TSA. We sort of became used to security screens and taking our shoes off, and now we have a fast track for pre-clearance. And, I anticipate that some of those cultural shifts or elements may become part of sort of the normal process, just like security became a normal process, taking a clear bag into a stadium or what have you for those reasons. So I'm optimistic. I'm an optimistic person. So what I try to do is say, look, no one wants to deal with this. None of us like this, but I think there are paths that are possible. I think adaptability and technology is critical to this. Obviously, we think we have a great solution, but I also think that there are some upsides, and we have to try to make some lemonade out of the lemons with respect to awareness of health and these new channels that we're creating for health-conscious consumers.
Andy, Vicki, thank you so much. A virtual round of applause for you. To the audience, thank you for taking the time to watch with us. But don't go anywhere. We have our closing keynote conversation with Scott O'Neill, and that's coming up right after this. Enjoy the rest of the day. Thank you.
Thank
Thanks,
you.
man.